Good evening. So, as Dr. Jakob kind of went through, diabetes is certainly a very complicated disease. I like to focus on more on type 2 diabetes because this is the more common diabetes that's diagnosed in adults. What I like to focus on is more on management. So what happens after diagnosis? Diabetes is really a long-term condition. So this really equals long-term management. The focus is not on cure, but prevention, specifically prevention of complications. I think that the management of diabetes can be boiled down to these 5 main objectives. First, take care of your blood sugar, take care of your blood pressure, take care of your eyes, take care of your feet, and then take care of your heart. Take care of your blood sugar. So this is kind of intuitive because high blood sugar is kind of the primary driver in this disease. High blood sugar directly affects the small blood vessels. So when the blood vessels are affected, they affect the kidneys, the eyes, and then your nervous system, the peripheral nerves. So how do we control our blood sugar? There are 2 ways to do it. Number 1, lifestyle changes. Diet, very important, and exercise. And then medications. Next thing, take care of your blood pressure. Why do we do this? Well, it turns out high blood pressure specifically worsens many of the adverse effects of high blood sugar. So we need to control your blood pressure. And what's the goal? Quite simply, less than 130/80. So next thing, take care of your eyes. As was mentioned before, the back of the eyes, the retina, is often affected in patients with long-standing diabetes. And this is actually the most common cause of legal blindness in adults in this country. How do we take care of your eyes? This is the easiest thing to do. Annual diabetic eye exam by ophthalmologist. A good dilated eye exam by an ophthalmologist can detect these early changes in the eye before any change in vision. Take care of your feet. High blood sugar really affects the blood vessels and nerves in your feet, which really place patients at a high risk for ulcers, infection in the feet, and when infection gets unchecked, in extreme cases can be severe enough to cause amputation. So how do you take care of your feet? 2 ways. 1, a daily self-examination and care. And your doctor can help you with this by doing at least annually careful foot examinations. So that's why when you go to your doctor's office for a diabetic check, they always ask you to take your shoes and socks off. Finally, take care of your heart. This is, again, a big topic because diabetes really increases the risk of heart, stroke, and heart failure. Off a side note, the relative risk of heart disease is increased in women with diabetes. So how to be heart healthy? Well, once again, recurring theme, diet and increased physical activity. And increased physical activity can be something very simple. It doesn't have to mean going out and joining a gym. It could be just half an hour of aerobic exercise, walking, at least 3 or 4 times a week.